Welcome to Discover Midwives, the podcast where we explore the art, science, and impact of midwifery. I'm Jessica Brumley, and each episode we'll uncover the stories, the history, and the expertise of midwives. This is your space to learn, connect, and celebrate the power of midwifery. Let's discover midwives together. I am so thrilled to welcome today to Discover Midwives, Dr. Nikkia Grayson. Dr. Grayson is a nationally recognized Black nurse midwife, family nurse practitioner, educator, and reproductive justice leader. She's dedicated to advancing equitable community-centered healthcare systems. She serves as the Chief Clinical Officer at Choices Center for Reproductive Health, where she helped build one of the nation's leading Black midwifery-led reproductive health models, integrating midwifery, birth center care, abortion care, sexual and reproductive health care, and community-based services. In addition to her clinical work, she's also an associate clinical professor at the University of California in San Francisco in the School of Nursing, where she prepares the next generation of midwives through reproductive justice-centered education and mentorship. Thank you so much for being on Discover Midwives with us today. Welcome.
Well, thanks. Thanks for having me.
So I like to start with a story, and I think that a midwife's sort of origin story is a great story to share. So I wonder if you can tell us what called you to midwifery.
Yeah, what called me to midwifery? I'd like to say that midwifery found me, especially before I really fully understood what midwifery was. Right? I did not take a direct path to nursing or to midwifery, and I worked in many different spaces, but I worked on a project where I was like interviewing these families about their experiences with infant loss. And many of those stories just stuck with me. I just could not, get them out of my head. And it really made me think about, how I grew up. I grew up surrounded by Black women who had, families and communities, together through, caregiving and and that resilience and wisdom that I saw in my own family. But in encountering these families, they talked about just brokenness and loss that they had experienced through infant loss, and that loss was like generational, right? And I just felt called to work with these women and these families in a, in a deep way. And I found myself really reading more about like Black midwifery and wanting to understand why we didn't have any Black midwives in our community. Especially after a friend of mine had told me, an older Black woman that's a friend told me that she had a midwife. And I was like, well, we don't have any midwives in the community. And I really wanted to understand why, like where were the midwives, right? And then where were the Black midwives, and it just, reading those stories, especially about Southern Black midwives and just the impact they had on the community and how they were seen as wise women and just, that they were beloved, and the care and the dignity that they had was, those stories just resonated with me. And I just felt like I wanted to see a reclamation of that. I wanted to see a reclamation and a restoration of, that type of care in our community. I wanted to see a restoration Black midwives in our community, and especially in the South, right? I live in the South now. I guess I'm a Southerner. I've been here over 20 years, and I saw what our communities were experiencing in terms of like health disparities and really the marginalization that we were experiencing and the distrust and the mistrust that they have in the medical community. And I just wanted to see a restoration of that level of care that these wise women, that these midwives, that these grand midwives gave to our community.
Wise women.
Wise women.
I think I could say that I know that you are revered as a wise woman in your community, and you've really built something really powerful at Choices. You've built a team that provides full spectrum, justice-centered reproductive care. What does that mean? What does that look like?
Yeah, so for us, full spectrum reproductive care means that we recognize that people's reproductive lives are complex and interconnected, and really, we just provide care across the lifespan, especially across their reproductive lifespan, right? And really meeting people where they are, right? So our care, of course, includes prenatal care, and we have a birth center and postpartum care, but it also includes abortion care and contraception and STI testing and gynecologic care and gender affirming hormone therapy and lactation support, all of the things that people need uh, for their primary reproductive health care, right? And we provide it all in one space. And I'll tell everyone that most people think that midwives just catch babies. We do more than catch babies, right? We are primary health care providers. And so it is our responsibility to care for the community in this way. And, for me, but the justice centered part is just equally as important, right? Like that reproductive justice is about more than access, uh, it's about really recognizing people's humanity and helping them to live their lives and care for their families in a just and dignified way. And so, we have to ask ourselves some bigger questions like, can our patients, afford food? Do they have transportation? Are they safe? Um, do they feel respected in their care? Can they actually access the care that they need? And so for us and for me, it was important that our model centers around dignity and autonomy and culturally congruent care. And, because many of the patients that we see are low income families and historically marginalized communities. And so we've intentionally built a space that is designed for them and designed for them and not thinking of them as an afterthought.
It's more than a space. It sounds like you've created a whole system of, of services and resources for people in your community. And that's not easy to do, right? Like our system is broken in so many ways. And to really provide that full spectrum of care, it has to be more than just the interaction that I have with that, one person. And so it sounds like you've really built a powerful system there. You mentioned that this work is really important, especially in the South.
Yeah.
Why is this so important now, and why especially in the South?
Well, the South is at the center of multiple intersecting crises right now, right? Right. We have this maternal mortality, we have hospital closures, we got provider shortages, we got reproductive healthcare restrictions, and really longstanding racial inequities, right? So for me, it was important for the South because, Black women in particular continue to experience disproportionately high rates of poor outcomes, right? Regardless of their income or education. And at the same time, many Southern communities have lost access to obstetric care entirely, right? We're talking about like just deserts, maternity care deserts, right? And then after Dobbs, we are seeing even more barriers to comprehensive reproductive health care. So, for me, what we're building, at Choices is proof that another model is possible, that midwifery-led, community-rooted care improves outcomes. And so it reduces, unnecessary interventions, it increases trust, it creates continuity, and importantly, it also allows people to feel seen and heard. And so, you know, um, like I said, I'm not from the South. I've been here for some time now, but the South has often been portrayed only through like deficit and struggle. But there's also, incredible innovation and resilience and leadership here. And um, I think the Black midwives have always been a part of that story.
Yeah, building joy,
Yeah,
of building,
absolutely.
right, of building care, a love into this work,
Yeah,
in a system that really isn't designed for that, very
no,
very well. Yeah, yeah. Um, your team provides, I think, deeply relational care is like, I think how I would describe it. Can you talk a little bit about what it's like to receive care from your team and maybe how
yeah.
that might differ from what's traditionally available in most hospitals?
Yeah. So, one of the things patients often tell us is they feel cared for as a whole person. And that's really important, right? Our visits are relationship centered. We spend a lot of time listening. Patients are encouraged to, ask questions and participate in their care. And that's very different. A lot of times patients are, passive participants in their care. And for us, we want them to come with their families. So families are welcomed into this process, and, our birth center model, birth is treated as physiologic and transformative, right? Uh, rather than automatic or as a medical emergency. And that changes the environment drastically when you really see this as like a transformative life event and as opposed to something that has to be managed, right? It just really changes how people experience their care. And so, the setting is a calmer and more intimate and more supportive. And, for us, especially for people that are in labor, patients can move, they can freely eat, they can labor in water and, and they can have the team that they want with them, And so our midwives really do know their patients' stories and what their fears are and what their goals are, and we know those things long before labor happens, right? So we're not just encountering them in that moment. And and with that said, we're also just highly trained clinicians. We monitor carefully. We use, evidence-based practice, and we know how to really recognize complications early, right? And so the goal is not natural birth at all costs, but the goal is safe, respectful, individualized care. And so that's important to us, right? So if someone needs a hospital care or they need a higher level of care, we are more than happy to transfer them to that higher level of care because, the patient safety always comes first. But for us, it really is about partnering with our patients and with our families. And I don't think that and I don't want to say that hospital-based staff doesn't want to do that. I just don't think the model supports that, right? And it doesn't allow for that level of interaction and relationship development. But I mean, because I know some amazing hospital-based midwives and I know amazing hospital-based nurses who really care about their patients. It's just that system doesn't allow that, right? And so I really feel that when we community birth center birth, midwives who practice in that out of hospital setting can really kind of facilitate that in a very different way.
When we talk about pain in childbirth, we often talk about how the environment and the support can impact someone's experience as well as their outcomes. And I think what you're highlighting is how the way that care is provided, by whom it's provided, in the setting in which it's provided, all of that is the intervention, right? Like
Right.
we think about all of these like technical aspects of care, but it is literally the relationship that's established and the way and the setting in which we're providing it that does really matter and that does really improve outcomes. That is the midwifery model
Yeah.
of care.
Yeah,
Um,
absolutely.
yeah. You talked a little bit about the additional services, right, that that are provided. And I wondered if maybe you might want to expand a little bit on what it means to center Medicaid patients in your care and why that's
Yeah.
important.
Yeah, I mean, that's really a really important part of what we do because in many healthcare systems, Medicaid patients are treated as financially burdensome, or, marginalized within, care delivery models, whereas at Choices, we've intentionally built this system for them, right? The majority of our patients are Medicaid insured, and many come from, communities that have been historically uh, just treated poorly, right? And that have historically, experienced barriers to care, just, having that lack of access. So centering, Medicaid patients means like designing systems around the realities of their lives rather than expecting them to navigate systems that were never built for them, right? So that means flexible scheduling, integrated services, patient, navigators, transportation support, culturally responsive care, longer visits, postpartum support. Yeah, it just means supporting them in a very different way and like really truly listening to our patients and understanding that their lived experiences are really do impact their care, right? Um, but it also means really believing that low income families deserve excellent care. They deserve beautiful things. They deserve this beautiful building that we built. They deserve to be treated with respect. They deserve to, just have that experience as well. And, too often healthcare, you know, resources flow toward people with privilege, right? But the communities most impacted by the poor outcomes deserve really the highest level of investment, to me, and deserve the highest level of innovation and compassion.
But our system's not set up to do that. So how have you created a system that has allowed you to be able to do that?
Yeah, I think one reimagining how it can be done, right? I think that most people think, oh, the system has always been this way or operated this way, so it has to continue to be that way and continue to operate that way, and it doesn't, right? Just realizing that, um, we do have the resources and means to do something different. I don't know if I ever told you, so I have a master's in medical anthropology, and one of a medical anthropologist who's also a physician that I strongly admired was Paul Farmer. And I would read his work, and especially his work that he was doing in Haiti with people who were HIV positive. And everyone had pretty much written these people off, written these communities off. And he was like, no, it is a way to provide them the care that they not only need, but that they deserve, and that these people can live and thrive. And so I've read pretty much everything that he's ever written, and honestly was extremely saddened when he passed away a few years ago. But he didn't just do it in Haiti, he replicated that in other communities where people just didn't believe that those people were worth the effort. And so for me, I think that, seeing that example in Farmer and seeing that he was able to do that in these spaces that were far less resourced than the communities that we are in, made me really believe that we could.
That's so inspirational. Oh, I love it. So one of the things I wanted to talk to you about was we've talked personally about how sometimes midwifery care can be idealized, right? That, there can be this sort of idealized notion of what is birth and what is, how normal physiology is going to win out, every time. And
Yeah.
But actually, we know that birth work is not for the faint of heart and
Oh
that
my
we
gosh.
can deal with real emergencies. Um, as an educator, how do you prepare, and as a practice director, how do you prepare future midwives and your midwives for this? And how does
Yeah.
your, team at a birth center, right, that isn't right down the hall from an operating room, prepare for emergencies?
Yeah, this is an important conversation, because there's both beauty and seriousness in this work, right? And birth can be deeply joyful and transformative, but it can change real fast. Um, but I think that midwives must be clinically excellent. We must be calm under pressure and prepared for emergencies. And I think that one of the things that we do at Choices is we're definitely training for that constantly. We do drills, we review cases, we focus on emergency preparedness and communication and teamwork and rapid, recognition of, complications, like hemorrhages or shoulder dystocias or whatever. But as an educator, I think I emphasize that midwifery is not about avoiding medicine. It's about knowing when intervention is needed and responding skillfully and quickly. And so for me, it's always, teaching my students, right? I can teach them the technical skills, but that's not enough, right? They have to learn humility and collaboration and critical thinking and really emotional resilience. And so, this work for me requires both clinical expertise and, and humanity. And so really teaching them that is key. And so, in many of the conversations you and I've had, we talk about, how this work has really been romanticized and, with the advent of social media and, and people taking the information and just, few minutes of videos and sound bites, it can be very seductive, but this work is serious and his work is very sacred. And so that's what I try to stress.
I've had people come up to me in, like, random public places and say, "Oh my gosh, you saved my life." And the thing that they say I did is something that feels so just like normal to me, right? Like that, it's a normal thing, but it can be really scary for them in that moment. Like the cord is around the baby's neck, right? And we're like, we see that every 5 births, right?
Right,
Like,
right,
yeah,
exactly.
and that was like never a thing, right? But
Right.
then sometimes literally people are, bleeding out in your hands,
Oh, yeah,
right?
absolutely.
And I think that I think it might surprise people that at the birth center you can start an IV and you have
Yeah, yeah.
medication and
Yes,
that
absolutely.
like there you have policies and you practice how you
Yeah.
will transfer someone to the hospital if they if they need it, and also how rigorous the care is and the screening is to help to make sure that someone is really well prepared. Like if they're super anemic, they're
Yeah.
not going to be likely birthing in the birth center because they
Right.
might
That's
need
right.
blood.
Yeah.
And we want to really be very very careful in those instances. And so
Yeah, absolutely.
birthing in the community isn't just you know um, me and two gloves and you squatting in a
Right.
corner, right?
Right. And herbs. I don't have any herbs. Okay. So,
I mean, you
yeah.
can have all the herbs you want, but
Right, right. I
Nikia's
mean, I
got
think we have some, but I got some real meds too,
I was
right?
gonna say Nikia
Right?
has a
Yeah,
medication card.
I am, right? I have all of the hemorrhagic meds, and all of the fluids and everything. I tell everybody we pretty much have everything in the building except for OR, right? So we just, we want to, yeah, we want to make sure that people are cared for and people are safe and that we're practicing safely.
Yeah, yeah. Um, what what else would you like to share with our listeners? What else do people need to know about midwifery choices?
Yeah.
Yeah,
Well, I think I want people to know that midwifery is not a fringe model of care. You know, um, it is evidence based. It is safe. Um, It is, essential really to addressing, our maternal health crises that we're seeing, and to address our reproductive health needs in our community. I want people to know that reproductive justice affects us all. That these conversations are about, dignity, autonomy, family, community, and the right to receive compassionate healthcare. I want people to know that choices is a replicable model. It's a replicable model. Yeah. That midwifery-led clinics are possible, right? And full spectrum midwifery-led clinics are possible. That we can provide care for all, right? I want them to know that abortion can't be separated from midwifery care. And I want them to know that, especially like young Black women, to know that there is space for them in this work. That we need more midwives, more healers, more advocates, more people willing to imagine healthcare differently, and that we're waiting for them.
Thank you so much. Thank you so much for being on the podcast and for being you, right? For doing all of the work that you do, imagining a more equitable future for reproductive people in this country. I want to leave our listeners with a message, right? This is the kind of care that you deserve. Care that listens to you, respects you, and includes you in every decision about your body. I hope that something in today's episode really resonated with you. And if so, I encourage you to write it down, talk to someone about it, really share this information, bring it to your next healthcare visit. Information is powerful, and it is only when we start to use it that anything begins to change. If you found this episode helpful, you can follow or subscribe wherever you listen to podcasts. Sharing this episode helps more people learn about their options and what respectful midwifery-led maternity care can look like. And thank you for spending time with me today. Take good care, and I'll meet you back here next time.
Discover Midwives was brought to you by the American College of Nurse-Midwives. To find a midwife in your community, go to midwife.org.